Welcome everyone. We're just going to give people a minute to join. Okay. Thank you everyone for joining us tonight for the ADEA National Member Update. My name is Jessica Downey and I'm the Education Officer at ADEA. Tonight's webinar will be recorded and will be made available on the LMS for later viewing. For this National Member Update, there are no CPD points as it is not an educational webinar. During this webinar, we encourage you to ask questions using the Q&A button at the bottom of the screen. These questions will be addressed at the end of the webinar. We will respond to these questions in the order they come in, so please try not to repeat a question that has already been asked. When we receive more than one question from a member, we will skip to the next member's question to ensure we respond to as many members as possible, then come back to all other questions if there's time. There is also a feedback form at the end of the webinar, so please keep your browser open after the webinar is complete to answer these questions. Please make sure your microphones are muted during this webinar. Okay. For tonight's webinar, I am pleased to introduce you to Anne Bush, President of the ADEA Board, Anna Blackie, Vice President of the ADEA Board, Susan Davidson, ADEA's CEO, and Natasha Veach, ADEA's Professional Services and Education Manager. I'll now hand over to Anne Bush for the Acknowledgement of Country.
Good evening, everyone. Welcome to the meeting tonight. I'd like to start by respectfully acknowledging the traditional owners and custodians of the land on which we meet. The traditional custodians of the land that I'm on tonight are the Wurundjeri Woi-wurrung people. I pay my respects to elders, past, present and emerging. I recognise their connection to country and the role in caring for and maintaining country over thousands of years. May their strength and wisdom be with us today. Okay, are you right for me to keep going, Jess? Yep, beautiful. Okay, welcome everybody. Thank you for joining us. I know that this time of the night can be a bit tricky for some of you, so really appreciate your attendance today. And for those of you who couldn't make it, hopefully you'll be able to listen in on the LMS and get some of your questions answered. I'm no doubt tonight you've got lots of questions about the new IT system and also the new credentialing pathway, and Natasha is going to be presenting on that in a little while. But in the meantime, I'm going to do some talking about some of the advocacy we've been doing in 2024 and what we're looking forward to doing in 2025 as well. But before I go on to that, I just want to thank the ADEA staff who have worked tirelessly this year. It's been a very busy year with the ICT transformation, as well as a lot of advocacy projects as well, along with a lot of the new educational things that we've been doing at ADEA, which we'll talk about a bit later. I'd also like to thank the board, who have also worked tirelessly for ADEA. Many of you may not know, but the board is a voluntary position, as most of the ADEA positions are, and the board puts in numerous hours trying to support our profession. We're very passionate about it, so we're made up of some CDEs, but also some specialist board members who come in with skills such as accountancy, legal, and other business based skills. So we really appreciate their input as well. I'd also like to thank all of our other volunteers with ADEA this year, people who have been on the program organising committees, both state and for the ADC, our CDE advisory panel, our research advisory panel, credentialing reviewers, CASP panel. It goes on and on and on. I just thank everyone who volunteers for ADEA. We couldn't do what we do without your volunteerism. So if you haven't ever volunteered for ADA, I encourage you to consider doing that. Okay, just moving on to advocacy. It's been a really busy couple of years in Australia for health reform and health advocacy. We've got a government that currently that has been extremely interested in health reform. And because of that, we've seen various health and workforce reviews happening last year and again this year. And they include things such as the parliamentary inquiry into diabetes, which was handed down a little while ago in July, and also the scope of practice review that's just been handed down. The health sector hasn't actually experienced this kind of interest previously, so it's been a very steep learning curve for ADEA, and also a very busy time for ADEA, running consultations and completing policies and submissions to support these reviews. And I think that the team have done a wonderful job in being able to get our profile out there and also to be heard. We have absolutely been heard, particularly in the parliamentary inquiry to diabetes and the scope of practice review, which is quite exciting. We've also advocated with Unified Partners, the Australian Diabetes Society, the ADS, and Diabetes Australia. And I think that this is really strengthening our voice because we're coming together, all singing from the same hymn sheet. So DA have been talking about credentialed diabetes educators, so have ADES, and we've been working well together, which is fantastic. It's really good to see that our health minister now in interviews will mention the credentialed diabetes educator. I was recently at a launch of a program where a CDE is running outreach for homeless people, and Bill Shorten was there, one of the ministers for the NDIS and My Aged Care, and he also mentioned the work that credentialed diabetes educators are doing. So it's great to see that now we're being recognised for all of our hard work. That's taken a long time for people to start mentioning us. We've also collaborated with other health sectors to champion the needs of people with diabetes and also to try and strengthen our workforce. The collaboration and advocacy will go on into next year, especially with the lead up of a federal election in the early part of the year. And plus, we've also got the budget, which will be coming up in May, and submissions for that will have to be in January because they generally finalise budgets pretty early. The success for advocacy takes a lot of hard work and also persistence. So whilst we've got some positive outcomes to date, they are just suggestions. They are just they haven't been brought into any policies as yet. So we have to continue to be able to bring those things, those recommendations, into fruition. So the work will continue, and over time, we will also be encouraging you guys to get out there. And I think next week there's going to be some comms to you about some grassroots campaigns where you can actually advocate in your local area with your local MPs as well to be able to get some of these recommendations, which I'm going to talk about in a little while, into policy. Last year or earlier this year, we submitted a unified federal budget submission. So by what that means is the ADEA, ADS and DA all put in a budget submission. And we will be doing that again for this year for the 2025 budget. And some of the things we were asking for in the budget submissions include remuneration for CDEs to initiate and support diabetes technology, an additional 5 CDE visits a year for the high risk population. So on top of the 5 EPCs they already get, an additional 5 that will be quarantined just for CDEs. We're looking for CDE remuneration for people with gestational diabetes. And again, we'll be working with our unified partners to put those documents together. There's plenty of information about our advocacy efforts online, and you'll see that there's some links here on these slides as well. So I just wanted to talk about the parliamentary inquiry into diabetes, and many of you would have seen the report that was handed down in July this year. We welcome the report and its recommendations. However, as I mentioned before, the government has not accepted any of these recommendations as yet. So we do need to keep advocating, regardless of who wins the election in the new year. That report still stands, and we will still be advocating for those recommendations to come to fruition. And some of the points of our advocacy on this are the diabetes workforce again, just increasing our diabetes workforce, increase access to CDEs, improved and equitable access to diabetes medications and technology, looking at pump subsidies for all type 1s, and also looking at CGM for type 2s. And also, very importantly, increased funding for research into diabetes, which has been sadly lacking. So the funding into diabetes research has been reducing over the last few years, and we need that to pick up, because we can all agree that we're actually in a diabetes epidemic at the moment in Australia. So there was also the scope of practice review, which was just recently handed down. The ADEA was very strongly involved with. So in both the parliamentary inquiry and the scope of practice review, ADEA not only put in a written submission, but we also got to testify at those reviews. So we were actually heard one-on-one, and we could bring our points to the panel. So in the scope of practice review, the reports and recommendations were handed down in November. And again, they're recommendations. The government hasn't accepted those. So we need to continue advocating for that. ADA has advocated for a clear and protected role and scope for CDEs, aiming at a unified scope of practice, allowing CDEs to work to their full capacity within a multidisciplinary team. Some of our key points of advocacy include direct referral pathways, so endocrinologists being able to refer to CDEs, but importantly, CDEs being able to refer to endocrinologists. We're also been advocating for a blended funding model, so moving away from fee for service so that we can work better as a multidisciplinary care team and get better collaboration between health professionals in the diabetes care team, and more importantly, better access for people living with diabetes to the credentialed diabetes educator. We're also asking for streamlining of regulations. So the regulations for standards of practice change from state to state in Australia. So we'd like to see that as being a unified national regulation, which will make things a lot easier and reduce some of the burden from states and national level. Just quickly, there's a couple of other things. I guess, have I got time? Yep, I've got a minute or so. Just a quick couple of other things that we have been doing. We've been working on the health technology assessment as well. So again, looking at getting better access to tech and support for tech for CDEs. We're also been working with the National Allied Health Framework. I think it's important to remember that when we're thinking about the role or the profession of the credentialed diabetes educator, we are actually under Medicare seen as allied health professionals. So our work with the Allied Health Professional Association is very important. one of the things that we were talking about with the scope of practice review with the chair of that review was the CDE is not a standalone health profession, and we are working towards getting that. And I think that's probably enough for me at the moment. Susan, did you want to add anything?
No, I think you've covered that very well, Anne. Thank you very much.
Thank you.
We'll move on to Natasha.
Thanks, Jess. So I'm here to discuss the ICT transformation update, and I think I'll start by just saying thank you to all the members out there. This has been a very challenging time for ADEA. We understand that when we're changing systems. It has been very challenging for staff and very challenging for members as well. And we hope that the new platform is easier to use. We know there's going to be some bugs and some fixes in the short term, but we really hope for an improved member experience. So we know in terms of the previous system, and if you've been with ADA a little bit, we had a very bespoke, very difficult to use platform that was very expensive to maintain and kept having more and more issues, I suppose, as we tried to maintain it. We had more and more issues with the platform. So from the member feedback that we kept receiving saying we need to fix the platform, we've obviously taken that feedback. We've gone out and done extensive consultation with regards to seeking tenders and things for the new platform. And it's been quite a long process for the team internally. We've been working on it for a couple of years now. And we did eventually decide on the IMIS platform for the membership, which is a platform that most, well, not most, but a lot of associations do use for membership. It's more of an out-of-the-box model, which is much cheaper to run ongoing. We also linked that in with Top Class, which is our learning management system. And then we've linked Top Class in with Credly, which is our digital badging platform as well. Now, another reason we needed to do this change is because we've obviously changed the initial credentialing pathway, and that wasn't able to be supported in the previous platform. So I'll talk about the initial credentialing pathway in a little bit, but first of all, we'll just have a look at the member platform itself. So at the moment, in terms of where we're at, the new member platform and LMS has been launched. So you are able to log on and utilize that platform at the moment. And I can see lots of people have, and we've been receiving lots of payments and people going into courses and things. So that's great to see. The initial credentialing pathway, the new pathway, is now live. So that is live on the new LMS. And like I said, I'll talk about that a little bit more. Payments and re-credentialing are able to happen in the new platform as well. So we know we've received a couple of hundred payments and things coming through. So we know that lots of members are able to do that. So that's great. Micro-credentials are available on the new platform. And again, I will talk more about micro-credentials as well, but I can see, again, lots of people purchasing those, which is wonderful. Now, looking ahead, so we know we've launched this platform now. We're currently embedding the platform, and it's a learning curve as well for our team. Just so you're aware, we have a very small team. Membership is consistent of 2 team members, and unfortunately, one of those has been away for a period of time. So we've had 1 person in membership, and I've been supporting by myself and another person, but it has been very, very busy for that person. So at the moment, we're embedding the platform. So for the next sort of few months, that's our main priority, is getting everyone onto the platform and making sure that everyone can access their account and do their membership and access education. So in the short term, we're actively addressing any bug fixes, and we knew there was going to be bug fixes. That's very standard when you're doing an ICT rollout. So we knew there'd be some bug fixes. So we appreciate you bearing with us on that. And I know a lot of you have been very patient, and we appreciate that because our responses are a little bit slow at the moment. So we really appreciate you bearing with us on that. The ongoing enhancements. So it's important to note this is an initial rollout of the platform. So in 2025, we'll continue to streamline and embed the process. So we understand there are going to be some bugs. There's going to be some things that might not quite make sense or might take a bit longer than usual. We value your feedback on that. So we do welcome your feedback on the platform. And we will be looking to make small tweaks and changes in 2025 to make it an easier system to use. So that's what the first year is really going to look like, is embedding the platform. So again, just reiterating that we really appreciate your patience during this really difficult transition. So I'll go to the next slide. Thanks, Jess. Okay, so key updates. These are just a few things to note in the new system that you may or may not have received communication from us about. So in terms of the rollout, we have been doing a very staged, slow rollout of the system. We originally communicated to a very small number of members to get them onto the system and to make sure that everything was working, make sure they could log in and make payments. So we originally went to a very small cohort. Some other people were able to log into the system, and if you were able to do so, that's great. A few people probably haven't had as many communications because we're doing quite a phased rollout. So it was only last week that we actually opened it up to everyone, but a couple of weeks before that, we were opening up to small cohorts. So in terms of logging into the system, and I will actually show you the system after this and step you through some of this just to give you a little overview, but key updates in the system. So access to the system, your username is your email address that we had in the previous system. So it's not your ID anymore. It is your email address we had in the old system. And please reach out to us if you're not sure what that is. Your new password, your previous password will not work in the new system. You will need to click forgot password and set up a new password because your old one will not pick that up. The integrating of invoices, so member payments and re-credentialing fees are now consolidated into one invoice. What we're finding is members were paying one invoice, then they were paying a re-credentialing invoice, and it was quite confusing and they were delayed. So what we've done now is consolidated them into one invoice. These invoices are now raised 3 months in advance of their due date. Now, you don't need to pay it 3 months in advance, but they're just raised on your platform so that you can plan accordingly. You can see you've got an invoice there and it's ready to be paid when you're ready. So there's no rush to pay it that far in advance. Membership renewals and your credentialing are now linked to the end of the month. For example, if you were 15th of January, you're now gone to 31st of January. Everyone's pushed to the end of the month. So it's that one date for your membership, one date for your re-credentialing. It's all at the end of the month. The membership category has changed slightly, and this is only for full members. Associate and student members have the same name. Full member has been replaced with a bronze member category. There's no changes to the category at this stage. It's the same category. But we are looking to introduce more categories possibly in 2025, perhaps 2026, but we're looking to do that. So that's why we've started with bronze in this system. So if you're wondering what that is, that's your full member category. So in terms of the documents, and I know we've had a lot of questions about the documentation in the new system. We're currently actively working to extract the documentation from the old system that you might have had in there. This is documents that say invoicing or documents you might have uploaded. We're currently working to extract them from the new system. This is quite a complex process. It's not very simple and it's taking quite a bit of time. So again, we appreciate your patience with that one. And it's important to note as well that ADEA now needs to comply with updated privacy laws. And the updated privacy laws basically state that we can only keep documents for as long as necessary. After that, we can't maintain the documents anymore. So if you have things in there from 10 years ago, we're not able to store documents. And this is for privacy reasons and things like that. So we do suggest, as we move forward with this system, if you do upload things into the system, please keep a record of it for your own personal records, because you may or may not, we may store a certain period and then we may not. So please just ensure that you do keep a record of it. And we are working to extract the documents at the moment. Jess, I might just exit out of your screen if we can. And what I might do is share my screen and I'll do a quick walkthrough for members, so that they can actually see what the platform looks like. And hopefully everyone can see this now. Is this coming up for everyone? Yep, a few head nods. Yep, great. Okay, so what you'll see as a member now, this is a front-facing, this is a member page and a non-member page. So that's important to note. That's why the Finder CDE, for example, is here. And you've got things like join membership, because this is a member-facing page and a non-member facing page. So you can see here, you've got Diabetes Connect, the Learning Hub, and becoming a member. Some of these you won't be able to access unless you sign in. So what I'm going to do here is I'm going to sign in. So if I click sign in from the top of the screen here, it's going to take me to the sign in page. My sign in page is slightly different to yours, and my sign in name is different, just so you're aware. It's not my email. I have a staff sign in. That's why mine is not my email address. But to reiterate, that is your email address. Again, if you haven't logged in before, you would click forgot password to match your email address. And then we're going to click sign in. As you can see here now, I'm logged in as myself. So from here, I have access to the Learning Hub. The Learning Hub is going to take me to the LMS. So I'm going to open that up. I can also access things like credentialing here. So I can go to initial credentialing or re-credentialing from here. And I can also access my own account. So if I go to my account, and this is where you'll find things like your invoicing, your CDE information. Your account will look like this, hopefully a lot more populated than mine. Obviously, being staff, I don't have anything in here. But you can see here, if you click transactions, for example, this is going to bring up invoicing. Okay, so you can see here, open invoices, recent transactions, that can all be seen through here. And if I look at my CDE profile, I don't have a profile because I'm not a CDE, but it will have your information here. So that's a very just general overview of what you can see, but you can see there's a lot more options here you can look at. Now, if I did click Learning Hub, so I'm going to show you the Learning Hub, is the Learning Hub where you'll access your education content, the re-credentialing pathway, and the initial credentialing pathway. So what you would do here is you can go to, again, I've got some functionality that you won't have, but what I can do is I can go to my Learning Center. Now, this is going to have your current, so current tells me what I'm currently learning. Completed will be any certificates. So if you have a re-credentialing certificate, a micro-credentialing certificate, that's going to show up here. Certifications is your re-credentialing program. So this is going to show you your progress in your re-credentialing program in this certifications thing. Now, if I want to find some certain type of education, I'm not going to go to the Learning Center. Is that going to help me? I'm going to search the catalogue. This catalogue lists all the education you can see. Now, depending on your member level and CDE status, you'll be able to see different education. This platform is set up for members and non-members as well. So you can see here, if I click micro-credentials, it's going to show me the 2 micro-credentials that are currently available. If I unclick that and click webinars, it's going to show me the webinars that I have available for my level. So again, it's quite an easy platform. Once I click on it and enroll into something, that's then going to show up in my education section as well. It's going to say that I've started this, and it'll allow me to start and restart whenever I need to as well into this platform. So hopefully that gives you a little bit of an overview of the platform itself. I won't go through everything, but hopefully that covers some of the main points that we've been hearing from you in terms of how to access and things like that. The other thing you might need to know is Diabetes Connect is also here. So that's just there. And I'll very quickly show you the initial credentialing and re-credentialing. You can see it's here. And I'll go through the initial credentialing a little bit on my next slide. So I'll stop sharing now. And Jess, I'll allow you to go share the next slides.
Thank you. Can everyone see that?
Yes.
Excellent. Thank you, Jess. So initial credentialing pathway, and some of you may have heard this quite a bit. Some of you may not have heard it so much, but I will just go through it a little bit. So as many of you may or may not know, we had a while ago, we had looked at our credentialing pathway. The pathway needs to be continuously evaluated. We know that the industry changes very quickly, technology changes, medication changes, and so we need to keep evaluating the pathway. Based on member feedback, the pathway was one of the more difficult things to complete in the CDE process. So we received a lot of member feedback about our pathway. So what we did was we did a bit of a project to redevelop the pathway. We did a lot of consultation with members, with stakeholders, with other member associations, and see what they did, a lot of benchmarking, and we came up with obviously the new pathway. So I'll outline very briefly for you what the pathway looks like in this. This pathway is currently set up in the new system. So I will touch on what to do if you're in the old pathway, but first I'll just focus on this one. So there's a few things that have not changed in the new pathway. And that's obviously the primary health discipline prerequisite, that still remains. Then we go on to completion of a graduate certificate. That's the same as the old pathway. Register an ADEA member, same as the old pathway. Log practical experience hours. So you can see these are now 500 hours. That's been a change from 1,000 hours. And this is based on the different skill levels we find people enter the pathway at. So some people enter the credentialing pathway as very skilled diabetes educators who the CDE status is that might be their last step. And then we see people entering the pathway who are less skilled. So it's important to note that this 500 hours is a minimum requirement. We absolutely encourage more hours where required, particularly for less experienced people trying to complete the pathway. So that's a minimum. You will also need to complete mentoring in this new pathway as well. That's the same as the last one. You'll need to complete your mentoring. The change we've added to mentoring is there's a lot more resources available to members, and I will show you how to access it on the new system, but there's a lot more resources now available for members to help you on the mentoring pathway at the moment. So we'll go through that. The new elements are the completion of the professional practice micro-credential. So many of you may or may not be familiar with micro-credentials. We've talked about them quite a bit, I feel, so I think a lot of you will be, but we've added a professional practice micro-credential to the initial credentialing process. This is really to help you with your understanding scope of practice and some of the rules and things around the CDE status. So the professional practice micro-credential is one that we have put into the pathway, but if you are a new CDE or new to the profession, we absolutely suggest you might want to have a look at doing that as well. And the final part is complete the practical skills assessment. This is a new workplace-based assessment that we've basically created. And this is really testing, well, I don't say testing, it's not testing. We're practically assessing that a CDE is ready to practice as a credentialed diabetes educator. So we're submitting a video into the platform, and we have a group of assessors who are using a rubric to assess whether they think the candidate is really ready to be a CDE, and that's the final sort of step in the process. So that's the new pathway. Now, if you are in the old pathway, so if you are still in the old pathway, it's important to note that we need to receive your application by the 31st of October, 2025. That's when we'll stop accepting submissions in the old pathway, by the 31st of October, 2025. The new pathway the old pathway does not fit into the new system. So it's not something you can upload into the new LMS. The old pathway is actually a separate process that sits outside of the system, and it requires a little bit more manual admin to upload documentation. So it is really important. We've heard from our assessors that it's taking them a bit longer to assess those applications as well. So if you do have an application in the old pathway, please just be aware it is taking a little bit longer because it's more manual and it now sits outside of our system. If you haven't alerted us that you're in the old pathway via the survey link that we provided a couple of months ago now, please do so. We will provide the link to you so that you have it. You will need to let us know you're in that old pathway, because there's no way for us to identify you in the new platform. So please let us know if you are doing that. Jess, I'll just stop to the next slide. I can't remember if I'm going to go to mine just yet, so I'll have a look. No, I will. So if you could stop sharing, thanks, Jess. I will quickly duck to I'll have a look at my screen here, and I'll quickly share what I've got here. Okay. Share, there we are. Hopefully that'll come up in a second. So hopefully now you can see initial credentialing on one side and re-credentialing on the other. Is that correct? You can see that? Yep, great. So for the initial credentialing in the new system, so this is the new pathway. Please be aware there's some important differences when you go to actually start this new pathway. As you can see, before you begin, we suggest you've completed the following steps, and that's 6 months worth of the mentoring program, the practical hours, and the professional practice micro-credential. Once you enroll in the pathway is only open for 90 days for you. So it's really important that you really wait to enroll in it when you have all these things completed. Then you can enroll in the new pathway. So you can see the information here. And if you scroll down, there is a little video here about the new pathway and transitioning to the new pathway. So we do suggest you watch the video, and please make sure you've got these things ready before you start the new pathway. Re-credentialing. I don't think it's going to let, oh, it is going to let me in. It's going to let me in. So re-credentialing is also done through the LMS. So like we discussed, it's done through your LMS as before. Jess, I'll just stop sharing, and if you can bring up that slide again. Okay, so this is just a show of what you're going to see if you go into the initial CDE certification. So the pathway, it's separated. So you'll see here, it's got the documents, the mentoring program. You need to enter each section individually. You click enroll, you complete that section, then you exit out and you go back into the next section. So you can see here, it says 89 days left to complete because you have 90 days to complete this. And there's different sections. So Jess, if you go to the next slide, you'll see here, this is what it looks like. It'll ask you to submit or enroll and submit documentation that you've completed the micro-credential. It'll then ask you to start your final 2 sections there. So it's a little bit separated out so that you can complete it when you're ready. It's not done in any sort of order. You can do it as you go, but we do suggest, like we said, you have your practical hours completed, your mentoring completed, and your micro-credential completed. Then enroll in it, and then you're doing the things that are left over, so your practical assessment. So it's not, you're not stuck for time there, because like I said, you do have 90 days. Now, if you've got any questions with regards to your own personal experience in the pathway, please reach out to us and let us know. But just understand right now, we're really trying to get everyone onto the membership platform and make sure everyone can, see the LMS and pay. Initial credentialing inquiries, we are sort of putting on the back burner a little bit. But please reach out to us. We will get to them. We're just a little bit behind at the moment. That's all. So thank you, Jess. I'll go to the next slide now. Micro-credentials. So I'll briefly talk about micro-credentials now, and I will show you the micro-credentials as well. So you can see a little bit of the background back there, and I know that a lot of people have probably experienced some of our micro-credentials in some way. So in 2022, ADEA and ADS jointly developed the National Diabetes Education Strategy. And that was a big focus on equipping all health professionals with a basic diabetes knowledge. Now, this is another reason we needed to upgrade our systems. Our old systems couldn't house these micro-credentials very well, like the new top class system can and the Credly badging can as well. So what we did with, we received the Victorian government grant, and through that, we were able to develop the system that we use in terms of top class. We were able to access some of the software that we use to create the micro-credentials, and then the digital badging platform as well. So a very brief overview on what a micro-credential is. They are small, stackable, bite-sized pieces of learning. If you've completed one of ours, you'll see how different it is from, say, a webinar or a podcast. They have the verifiable digital badging that goes with them, which you might use for your resume. You might use it on the bottom of your email. You might use it on your LinkedIn profile. It's basically saying to everyone, I've been upskilled in this area, or I have more knowledge in this area as a CDE, for example. So right now, in terms of our micro-credentials, you would have known that in 2022, we released the CGM micro-credential. That was our first sort of dip into the waters in terms of micro-credentials, and that was on the back of expanded CGM access. Our current micro-credentials look very different to that previous one. That one was done, like I said, in different platforms and was very quick, but our ones now will look very different to that previous CGM one. So I'll go to the next slide here, Jess. So you can see here what we're currently developing in terms of the micro-credentials. So right now we have the insulin pump micro-credential that's available. That was released a couple of months ago. The professional practice micro-credential is what I spoke about in the initial credentialing pathway. That's also now available. So again, if you're a new CDE or new to the profession or a student, you might want to look at that micro-credential. The medication micro-credential we have planned to launch next week. That's actually a 2-part micro-credential as well. That CGM micro-credential that we did back in 2022, that's now going to be changed. We know there's been updates, so we thank you for your feedback on that. We have been receiving member feedback and we appreciate that. So what we're doing with that micro-credential, it's actually going to be split. If you completed it back in 2022, you'll have access to a refresher CGM micro-credential, which will be linked to one of our digital badges now. So you can simply complete the refresher if you did it back in when it was first released or since then. If you didn't do it then and you'd like to do it now, basically what we're doing is breaking it down into 3 different micro-credentials with all the updated information. So it's going to be broken down into separate ones. When we first released it, it was a very long micro-credential. The plan for micro-credentials is they're usually only an hour and a half in length. That one was particularly long. So that's currently being broken down and it'll be offered as a 3-part micro-credential, if not in December, in the new year, so around January, we hope. Sometimes it depends on the information we get back from the pharmaceutical companies, which we need to update the micro-credentials. So we also have more planned, and I know that from talks with Donna, our education manager, and Jess, who's now in the education team, there is a lot on the horizon in terms of micro-credentials, and we're not doing just member ones for CDEs and diabetes educators or just members. We're actually expanding that horizon to different associations, different healthcare professions as well. But there'll be different level micro-credentials. So they'll start at a very low level and they'll only have access to a very low level of micro-credential. CDEs will have access to a higher level of micro-credential, and they'll also be stackable as well. So the plan is you might complete one, come back in a few weeks, complete the second or third, and they aim to be stackable as well. So stay tuned. There's a lot more micro-credentials coming in 2025 and 2026. And again, it's a better way of delivering our education, which is really exciting. And I know the team is very excited about that. Now, I feel like I've been talking for a really long time, and I hope that's really helped. So I would say that if there are any questions, please do put them in the chat if you've got anything that you'd like to know. I would just reiterate, if you do have questions about the initial credentialing pathway or re-credentialing, and they're quite specific to you, perhaps email us on the CDE email, which we can put in the chat, but it's basically cde@adea.com.au, because it is difficult to answer specific questions sometimes around these pathways because everyone is slightly different. So sometimes we need to look at it. So just something to keep in mind if you are answering any questions, but please put it in the chat. Okay, I have got a question here and I'll start reading them out. So what do you do if you're self-employed and do not have a supervisor for your hours? So I know that I've got Donna, our education manager, on tonight. So I might pass that question over to Donna if I can.
Thanks, Natasha. I mean, similar to the previous system that we had, it remains the same. So if you're self-employed, you obviously would get referrals from either a GP or someone that's referring to you for diabetes education. So you're wanting to have someone that's very familiar with your work. So whether you're supplying reports and things like that, they're very familiar. They can sign off on what you've actually provided. So that is what incurred in the previous system. So anybody that's very familiar with your practice. So I hope that answers that question.
Donna? Will my re-credentialing come across from the old platform? I had a couple of months worth of data in there. It wasn't there when I checked today. So I'm probably best to answer that one. We are extracting documents from the old platform. So anything that's a document, we're looking at extracting that from the old platform. If you've entered specific descriptions of things into the previous platform, that is not able to come across. The two platforms are very different. They're not the same pathways. They're different systems. So they don't read the data the same. So it's not as simple as trying to extract it and reload it. It doesn't work that way in the new system. So documents, we're absolutely trying to get across, and we're trying to do that in the next few weeks. And if you do have documents you need access to, please email the team and tell them what you're trying to access and why, because that really helps us to understand what we need to get out of the system. Do we still have to register the mentor-mentee agreement if we're not starting the initial credentialing process until this is done? I might pass that one over to Donna.
Yep. Sorry, Natasha, you cut out then. What was that question again?
Sorry, Donna. Do we still have to register the mentor-mentee agreement if we are not starting the initial credentialing process until this is done?
So the agreement, yes, you still need to register it. So you need to enroll into the mentoring program, which is available through the catalogue. And in that, it'll outline a step-by-step process of the mentoring program. It will guide you as to, it's got all the resources in there, and it will have all of the templates, including the agreement. So you will need to sign that you've entered, or upload that you've entered into a mentoring agreement. All of this documentation, all of this can be done before, as Natasha mentioned, that you enroll into the initial credentialing pathway.
Thanks, Donna. I've got another one for you, Donna, because I know you love it. So the first part is I finished the initial insulin pump therapy micro-credential, but I don't think that was the question. You've jumped back on and said, how do I upload the micro-credential badge into the system?
Yeah, so we're currently working. There are a lot of people that completed the insulin pump micro-credential and were issued badges. We're currently working on incorporating those badges into the system. Obviously, because they were done outside of the new system, that requires a little bit of extra work to actually put them in. So we're currently working with Credly and working out a way in which we can do that. So it will display within your badging platform in the new system.
Thanks, Donna.
Additionally, if you do have a Credly account that you've set up, when you should have received an email note from Credly notifying that you do have been issued a badge. If you've actually created a Credly account too, you can access your badge there to download.
Thanks, Donna. What will the focus of the support worker micro-credentials be? I think they're referring to the additional micro-credentials we're looking to create for the different health professions. So I can answer some of that, but Donna, do you want to provide an overview of what that's looking like?
Yeah, so obviously in alignment with the National Diabetes Strategy, it's to create education for all levels of health professionals, so right through from health assistants right up to CDEs and specialists. So we are looking at creating education across all levels in accordance to our micro-credential framework. So that would be tailoring to the levels according to the capability frameworks that we have in place and what level of knowledge would be expected for those levels. So if you have a refer to the capability framework, it'll outline all those levels of what's expected for level 1 right through to level 6. So that is what we'll be tailoring our education for. So it's based off of that micro-credentialing framework.
Thanks, Donna. I'm so glad we have Donna on tonight because I've got more coming your way, Donna.
Oh.
What if we've already done a mentor agreement and they're wanting to use the new pathway? Do we need to redo it? You don't need to redo that. If you've got that mentoring agreement, you can upload that into the mentoring program. There is a guide there that will, as you step through that, it will actually allow you to upload that agreement. Thank you, Donna. Why are we changing the title full member to bronze member? Is there more to this? So as mentioned, we are looking at the categories of membership and what we offer in the different categories. It's important to note that everyone has different sort of levels and requirements from ADA as a member. You know, everyone's wanting different things. And so we're really coming in line with other associations to offer different things for the different levels. So the change to bronze is just the start. We haven't fully explored the other categories just yet. So we will provide more information when we do that a bit more. Susan, do you want to add anything there about the categories?
Yeah, thanks, Natasha. I guess what what the idea of these categories is that it creates flexibility in the system to create a more bespoke membership offerings. So some members want to interact with ADA in a lot more ways than others. So it's a way of just enabling us to communicate with members and create those different offerings according to what members need. It's only a concept. It's, as we said before, this is a platform that is used by a lot of other associations. So this is built into the platform. So we're just, I guess, enabling that possibility in the future. It's not something we're doing just at the moment.
Thanks, Susan. Donna, re-credentialing, are there still 3 compulsory categories?
Yeah, so that has not changed, the re-credentialing points. So still refer to the CPD points guide that we have. So we still have the 4 categories. We still have 15 points within our primary categories. So whether that be clinical practice or management. That has not changed, and we still do require 1 point in the other compulsory categories, which are category 2 and 3. So that all still remains the same.
Thanks, Donna. Yeah, it's a good point. So the new pathway does look a little bit different in the new LMS, just in terms of how you put documentation into it. But it actually, as Donna said, it hasn't actually changed at all in terms of what you're required to do. It just looks different when you're submitting things. Are we able to upload re-credentialing documents on the website? I'm assuming you're referring to if you undertake the credentialing pathway, are you able to upload when you say we, I'm assuming you mean yourself as a member, are you able to upload documents? Yes, you are in the new pathway. Yes, is the short answer. But Donna, do you want to expand on that at all?
So re-credentialing, is this if it's referring to the CPD evidence? Yes, you can add your evidence at the bottom after via the external activity function.
Sorry, Donna, thank you. They've just clarified.
Yeah.
It is evidence they're talking about
Yes.
there.
Yeah. Yes, you can. So anything that you complete on the platform, automatically the points will go across into your completed section within your learning center. Anything that you've completed outside, so whether it's an ADA endorsed activity or a workshop relating to diabetes education, you can enter it as an external activity. So you can do this by clicking on a drop-down box in your completed section, and it will show you to add an external activity. And this is where you can fill it out and you can attach your evidence. So whether that be a certificate of attendance or evidence or receipt or anything like that, you can add.
Thanks, Donna. So that's really worth noting that Donna has actually created a wonderful 16-minute video for re-credentialing, and it steps you through the entire process of re-credentialing. So if you are hitting any barriers or something's not quite working as you think it should, please do watch the video, and we'll include the link in this webinar somehow. I know Jess will absolutely do that, but please watch the video before you try re-credentialing. It really steps you through the process, and we found that most people, if they've had an issue, they've watched the video, they've understood it a bit more. So there are a few just different things that this system does. So it's great to watch the video and really understand what that looks like. And re-credentialing should be easier now because, like Donna said, anything you complete within our LMS will already be in your completed section. So it should save time in terms of that manual upload process you were having to do previously. You shouldn't need to do that for our new system if you've completed it within the system. So that should hopefully make it all a little bit easier for you as well if you are re-credentialing. We don't have any other questions at this stage, so I'm not sure if anyone else has any further questions, if you need to put them in the chat. But at the moment, that's all our questions have been answered. So I'm not sure if, Susan, you've got anything you'd like to add in there?
Yeah, we did actually receive a couple of questions before this webinar, so I might just sort of read those out, I guess, and answer those as well. So one of those questions was, does receiving the pump micro-credential mean I'll be a certified pump trainer? And the answer to that is no. The micro-credential complements the existing CGM micro-credential and extends it to pumps. But overall knowledge of the various technologies and specific in-depth training in a particular pump is still required. And this is at the moment provided by pump companies, but we are looking over time to bring together the pump company training and the micro-credentials. So I guess that's just a flag for the future, but we're not there yet. The other question was an advocacy question about the Australian College of Nursing campaign promoting increased scope of practice for nurses, and why ADEA wasn't involved with that Australian College of Nursing campaign. So I guess the short answer to that is that we were campaigning with various partners for the same things. We're very heavily involved in the scope of practice review, as Anne mentioned, and the scope of practice review is for all health professionals. So, you know, given that the CDA profession includes members from a range of underlying professions, we thought it was very important that we had our own voice. We are a little bit different to some of the other professions as well. So we had our own voice in the scope of practice review, and we are continuing to advocate for that increased scope of practice. And as Anne mentioned earlier, we'll also be asking members to join in our campaign. The more voices speaking up and members contacting their local MPs and senators prior to the election and also prior to the federal budget, which is usually around May. That may change, of course, with the timing of the election, but the more members get involved in the campaign, the more effective our advocacy is, the more voices amplify our message. So there are two questions that were received prior to the webinar.
Thank you, Susan. We've had no further questions at this stage. So if you do have any questions that you do want to ask, please do send us an email and reach out to us that way. But I will reiterate, we are experiencing slightly longer wait times at the moment because of the system transfer and workload. So please bear with us, and we do appreciate your patience during this transfer period. We understand it has been challenging. That's all from us.
All right. Thank you, everyone, for your questions. I'd like to thank Susan, Anne, Anna, Donna, and Natasha for tonight. That ends the webinar. This webinar has been recorded and will be uploaded on the LMS shortly. Thank you, everyone, for taking the time to join tonight and participate in the Q&A. If you have any further questions, please email cde@adea.com.au for membership questions, education@adea.com.au for education questions, and for all other inquiries, you can email inquiries@adea.com.au. These emails have also been posted in the chat feed. Also, please remember to keep your browser open to answer the survey at the end of the webinar. Thank you again for joining us, and have a great night, everyone.